So welcome back to the reading live. So did you all do the question? Okay. So Reba, Dinu, Shabna, Libby, good afternoon. Okay, so what about the answer? Any idea? Let me know in the comment box. What is your answer? Okay, so I'll read the question first, then I'll read the options and the paragraph. Okay. So the first question, the memo reminds the natural therapist not to. Okay, so whenever you deal with this type of a question, I mean a negative question which is not true, always be careful. Okay, and when you read a question, always connect with your options. Clear? So the question, so first of all, the first important step is read the question. Okay, the memo reminds the natural therapist not to. Then the second step, underline the keywords from the question. So what are the keywords from the question? Okay, so my keywords, it is reminds, then natural, then not to. So these are my keywords from the question. And the third, which is the most important one, understand the question. Okay, so when you understand the question, remember about which category of question is this. Okay, so which category of question? Any idea? Any idea, Reba, Baiju, Shapna, Libby, any idea? In which category the question falls under? Any idea? Which category of question is this? We have three categories, and out of this three categories, in which category this particular question falls under? Okay, hi Clarina. Yes, which category? Any idea? In which category the question falls under? Okay, so this is a memo. Yes, very good. Yes. Okay, so this is a memo. So which means this is from the last category. Okay, the third category. So there we have email, memo, notices. Okay, and very clearly in this question they have mentioned this is a memo. So the second one, memo. So what is a memo? So we are sending memo to someone else with a particular purpose. Okay, we just need to send an information, so that is why we are sending a memo, and there will be a sender and a receiver. Okay, then so this is a memo which reminds the natural therapist not to do something. Okay, so what is that? Then the next one, so if it is a memo, what are you reading for in the third category? If it is an email or a memo or notice, what are you reading for? Any idea? What are you reading for in the third category? So this is from the third category. Very good. Yes, Janita. Okay, Baiju. Yes, Shapna. It is from the third category. Yes, Ton. So if it is a third category, then what are you reading for in that particular category? Okay, Jinu. Yes. Okay, Purnima. Okay, Ruby. It is category 3. Then what are you reading for in that category? Okay, Ruby. Very good. It is for the purpose. Okay, so we are reading for the purpose. Yes, Janita. It is for the purpose. Okay, so purpose, which means the overall idea of the text. Clear? Okay, and especially when you deal with the third category, just give a special focus to the last lines of the text. Okay, I'm not saying that last lines will be the answer, but still the last lines will give you a clue towards your answer. Okay, maybe not. Okay, so I'm just connecting my options. So the memo reminds natural therapist not to the first one, prevent the suffering and dying of children from diseases. So my keywords, prevent, then children, diseases. Okay, then option B, not to uphold homeopathic medicines to conservative vaccines. So my keywords, uphold, then homeopathic, conservative. And option C, not to support the false myth due to the lack of scientific evidence. So my keywords, support, then false myth, lack. So these are my keywords from these three options. So any idea which is the correct answer? Okay, Janita. Okay, Ruby. Purnima, Shabna, Suja. Okay, Gausalya, it is purpose. Very good, very good. It is for the purpose. We are reading for the purpose. Okay. Then what about the answer? Any idea what is the correct answer here? Okay, so I'll read the paragraph, then let's decide. So homeopathic immunization, that is the heading. Okay, so children are still suffering and dying unnecessarily from the preventable diseases of childhood. Okay, whilst the incidence of these diseases has declined dramatically since immunization was introduced, there are concerns regarding parental apathy in the absence of frequent graphic reminders of these diseases. there are community misconceptions. So see, community has some misconceptions. So which means we can relate that particular term false myth to misconception. Okay, so here false myth, which means misconception. So natural therapist have not any misconceptions here. Community has some misconception. So that you can eliminate which option? You can eliminate option C. It is contradictory option or opposite option. Okay, because natural therapist, it is in the question, but in the option it is all about false myth due to lack of scientific evidence. But what about the paragraph? Paragraph, they have mentioned community has some false myth or misconception. Okay, so eliminate option C. Then that catching the natural disease is preferable to vaccination. This is not true. This risk of complication, the risk of complications from these diseases far outweighs any risk associated with vaccination. Then some natural therapist including, so here comes the keyword from the question. So what is the keyword? Natural therapist. Okay, including well-known community identities are promoting which means they are supporting homeopathic regimes for immunization instead of vaccinations. Then there is no scientific evidence of immunity being established by homeopathic immunizations, and parents put their children's health at risk by consulting untrained homeopathic practitioners. So Australian Natural Therapist Association has advised the health department that fully trained natural therapist, again keyword from the question, okay, natural therapist would not advocate, so which is the same like here, therapist not to, okay, not to advocate which means promote, support homeopathic medicine as a complete total alternative to the vaccination. Okay, so from the last line I can trace my answer towards option, it is option B. Okay, so that we can connect with option B. See, uphold, not to support. So uphold which means not to support homeopathic medicines to conservative vaccines. So answer is option B. Clear? So what about the first one? Why we are eliminating option A? Any idea? Okay. Okay, yes, Ton, Gausalya, Anjali, Janita, Shapna. Answer is B. Okay. So why we are eliminating option A? Any idea? Why we are eliminating option A? Already we have eliminated option C because it is opposite option or contradictory option. And what about option A? Yes, what about option A? Hi Sobi, good afternoon. Okay. So what about so yeah, so what about option A? Very good Sindhu, it is not mentioned anywhere. Okay, so prevent the suffering, actually it is not mentioned, which means again it is contradictory option or opposite option. Why? Because not to prevent, so nowhere it is mentioned don't prevent the dying of the children. Okay, so that is contradictory option or opposite option. Clear? So answer is option B. Okay, yes Janita, so answer is option B. Any doubts in that, in this particular question? Clear? Okay, so now let's move to part A. Okay Jinu, yes Sindhu, it's not mentioned. Okay, okay. So yes, coming back to part A. Okay, so we have another new topic here, which is polyarthritis nodosa or PAN. Okay, so how is the material? Very easy material, right? Okay, so let's start with the first question. But before that, let me know in the comment box, what do you know about part A? Any idea? What do you guys know about part A? How many questions? What about the timing? Any strategy that we are using here? And what are the keywords from the question? Okay, so how many questions in part A? Yes, Janita, Sindhu, Jinu, Shapna. Anjali, how many questions in part A? Okay, so as you can see here, we have total 20 questions in part A. Okay, so within 15 minutes, 15, yeah, very good Shabna, 20 questions, okay. So within 15 minutes, we should complete 20 questions. Okay, so what about the categories of questions? So these 20 questions can be categorized into 3 different sections, which is 1 to 7, that is, match the following questions. Okay, 1 to 7, match the following. Okay, so what we have to be careful when you do match the following question? Any important instruction here when you do match the following question? Okay, Sindhu, yes, Sakku, Asha, 20 questions. Okay, Riba, 20 questions within 15 minutes. Yes, Janita. Okay, Akku, 15 minutes. Okay, Anjali, 20 questions. Okay, within 15 minutes. Okay, Alina, 20 questions. Yeah, skimming and scanning method. Okay, so what about match the following questions? What is the speciality of match the following questions? Okay, so I can say either you can write, you can find out these answers, you can locate your answers from either text A, B, C or D, which means in part A, we should deal with 4 different texts. Okay, text A, text B, C and D. And one of the text will be a pictorial of something. Okay, maybe a table or a chart or a diagram, so whatever it is, we should deal with a pictorial. Okay, then in match the following questions, we don't have to write that exact answer there, but still we should answer in which text the answer is from. Okay, if it is from text A, you can write A. If it is from B, you can write there B. So likewise, just mention in which text the answer is from. Okay, so that is match the following questions. Then comes 8 to 14, which are short answer questions. Okay, so in short answer question, what is important? Okay, so what is important in short answer question? So as you can see here, the important instruction given by them, which is you can write it in a word or a short phrase. So word itself is a word, right? So what is a short phrase? So short phrase, which means maximum 3 words. Okay, so don't write more than 3 words in this particular question answers. Okay, so short answer questions, and always answer to the question. Okay, so whatever the question is asking you, just answer to the question. Don't add anything extra. Clear? Okay. Then the final one, which are 15 to 20, those can be fill in the blanks. Okay, so same instructions here, like in the previous one, you can write it in a word or a short phrase. Okay, so which means maximum 3 words. Okay? Yeah. Then what about the criteria? Okay, or what about the strategy? Which method we are using here? Okay, the method which is called, yes, Anjali, the method is skimming and scanning method. So what is skimming and scanning? Let me know what is skimming and what is scanning. What is the meaning of the word skimming? Any idea? What is the meaning of that particular word, skimming, and as well as scanning? Yes, Alina, Janita, within 15 minutes, 20 questions. Okay, Anjali. Okay, Akku, skimming and scanning. Okay, Akku, what is skimming? Any idea? What is skimming? What is skimming? What is the meaning of the word skimming? Okay, Riba, very good, Akku. Yes, it is fast reading. Okay, so if you want to fast read something, it is very important you should do additional materials every day. Okay, so what about scanning? What is scanning? Okay, Shapna, yes, very good, dear. It is fast reading. Okay, skimming, which means fast reading. Okay, so what about scanning? What is scanning? Yes, Selin, it is fast reading, speed reading. Very good, dear. Yes, what about scanning? Okay, Libby, quick reading. Okay, so we can say skimming, which means fast reading or speed reading or quick reading. Yes. Okay, Janita, searching for important words. Excellent. Yes. So scanning, which means we are searching for some important keywords from each of the text. Right? Yes. Okay. Okay, Asha, skimming means fast reading with highlight words. Okay, skimming actually means fast reading, but highlighting the words, which means you are searching for some words. Okay, so that comes under scanning. So skimming and scanning, which means fast reading plus searching for some important words. Yeah. Okay, Akku, identify important points. Okay, so my next question. How will you identify important words? Okay, so we are applying this technique or the strategy called skimming and scanning. So while you skim and scan, how will you know or how will you identify these words are important? How will you identify important words? Any idea? How will you identify important words from the text? Okay, for example, yeah, when you read something, definitely we should know these are the important words. So how will you identify, okay, these are the important words? Okay, very good, Reba. We have 13 key points. Okay, so let me know what are they. Any idea? Okay, Baiju, search for important words. Okay, dear. Yes. Okay, so be 13 key points. Yes. So what are the 13 key points? Okay. I'm so happy that you guys know about it. Okay, so what are the 13 key points? When you skim and scan, we should be very careful with the keywords. Yeah. So what are the keywords? Or what are the 13 important words that you guys will locate or you will mark, highlight? Let me know what are the 13 keywords. Okay, so the 13 keywords, which are the first one. What is the first one? Heading. Okay, yes, heading and subheading. So heading is the first one, subheading second one. So when you read a text, always be careful to underline all the headings as well as the subheading. So that is the second one. Then what about the third one? Any idea? What is the third important point? So heading, subheading, then third one. Okay, so be capital letters and bold letters. Okay. So what about third one? In that particular order, can you tell me what is the third one? Okay. Okay, abbreviations, numbers, heading, first and last line. Okay, Anjali, heading, subheading. Very good. Third one is numbers. Okay, so which means you can mark all the numbers. So sometimes they will mention the numbers in the form of figures as well as in words. So whatever, if it is a number, just mark all the numbers. Okay, so that is the third one. Then what about the fourth one? Fourth point. Okay, very good, Anjali. It is signs and symbols. Okay, not signs and symptoms, signs and symbols. For example, I can say percentage. Okay, percentage is a symbol. Then less than, equal to, greater than, beta. Okay, so likewise we have a lot of signs and symbols. Okay, so that is the fourth one, signs and symbols. Then fifth one. What about the fifth one? Any idea? Heading, subheading, numbers, signs and symbols. Then fifth one. Very good, Sindhu, signs and symbols. Okay, Sindhu, what about fifth one, dear? Any idea? Okay, fourth one, numbers. Very good, Baiju. Yeah, what about the fifth one? Fifth point. Very good, names. Okay, Sindhu, it is names. So names, which means, for example, name of a person, name of a disease condition, name of a country, okay, name of a medicine, name of an equipment, a machine. So whatever names, pronouns mentioned, you can mark all the names. Okay, so 5 points, heading, subheading, then numbers, signs and symbols, all the names. Then what about the sixth one? Sixth point. Yes, okay, Manisha, hi. Okay, so what about the sixth one? Any idea? Very good, Sobi. Yes, fifth one, names. Okay, so what about sixth one? Sixth one. So heading, subheading, numbers, signs and symbols. Fifth one, names. What about sixth one? Word which indicate time. Yeah, it is one of the point, but still it's not the sixth one. So what about the sixth one? Okay, Reba, brackets. It's not the sixth one, it is one of the point. Yeah, again. So what about the sixth one? Very good, abbreviations. Okay, so yes, Reba, sixth one is abbreviation. So abbreviation, which means short forms. Okay, so here polyarteritis nodosa, which means PAN. So that is the abbreviation, right? So abbreviations. Very good. Then what about seventh one? Seventh one. Heading, subheading, numbers, signs and symbols, names, then abbreviations. 7th one. What about the 7th one? 7th one. So 7th one, that is bracket. Okay, so we can mark all the brackets. So whatever brackets they have mentioned, mark all the brackets, that is very important. Okay, and what about 8th one? 8th one, 7th one brackets. Very good, Sindhu. Yes, Shapna, all the brackets. Yeah, so what about 8th one? 8th one, after brackets. Okay, so 8th one. Okay, so be brackets. So after brackets, what is the 8th one? Okay, so 8th one, it is italicized or bold words. Okay, so you can mark all the italicized or bold words, which are very important. And what about 9th one? So 9th one is actually what you guys said. Okay, Sindhu, italic and bold words. Okay. Yes, Ellen. Yes, italicized or bold words. Okay, Anjali, letters italicized or bold. Okay, so what about 9th one? Any idea? 9th point. So 9th point is all about, yes, already you guys told me that it is the words which indicate time. Okay, for example, can you please tell me what are the examples for the words that indicate time? Okay, Selin, words indicate time. So yeah, so what are the examples? Give me some examples for words indicate time. Any examples? The words which indicate time. So what are the examples for the words indicate time? Very good. Yes, now. Now is a word that indicate time. Currently, presently, yes, before, okay, after, early, delay, then when, W-H-E-N, when, during, previously. Okay, so yeah, so words indicate time. And what about the 10th one? Okay, so 10th one is very important, which is the words that indicate experiment related words. So what are the words? Any idea? Yes, Sindhu, during, before, currently. Okay, Riba, currently, presently, delay. Yes, very good. What about 10th one? The words which indicate experiment related words. What are the words that can be related with experiments? Okay, so be longer, now, yeah. Few is not actually related with time. Few can be related with numbers. Okay, yeah. Few which means nothing, a few which means some. Yeah. Okay. So what about the words that can be connected with experiment related words? Okay, the word itself, experiment, yeah. Then clinic, the term clinic, clinical. Okay, observation. Then what can I say? Identification, diagnosis, ascertain. Okay. Yeah, very good, Reba. Clinical observation, understand. Yeah, very good, Sindhu. Understand, yes. Understand, clinical observations, then identification, ascertain, then diagnosis, procedure. Okay, test. Yeah, likewise, there are a lot of words that can be connected with experiment. So that is a 10th point. And 11th point, words can be related with research related words. So what are the words that can be connected with research? Any idea? What are the words that can be connected with research? The word itself, yeah, research, researcher. Then any other words? Any other words? Because when you read each of the texts, you can see a lot of words connecting with research. Okay. Very good, Selin. Study. Yes, very good, dear. Study is a word that can be connected with research. Okay, Sindhu. Sorry, dear. Actually, observation you can connect with experiment. Okay. Study is a word that can be connected with research. Yes. Very good, Selin. Examine. Okay, examine is a word can be connected with research. Okay, study. Yes, Shebi. Yes, Riba. Asha. Yes, study. Very good. Find. Find is a word. Actually, find is not a word that can be connected with research. Find is a word. It is connected to experiment. Finding. Diagnosis. Test. Okay. Then. Okay, I'll give you some words. Okay. Administration is a word that can be connected with research. Study is a word that can be connected with research. Research, researcher, then population. Okay, population aspect, ASPECT, aspect. Okay, aspect. So these are the words that can be connected with research. Okay, and 12th one, I'm not asking you to mark it very clearly, but still give a special attention towards the first and last line of each and every paragraph, as well as all the bullet points. Okay, so these are the 13 important words. I hope it is clear. Clear? Any doubts? Okay, so these are the 13 important words. So when you do additional materials, always apply these particular strategy. Okay, the 13 keyword strategy, then definitely you can mark 20 out of 20. Okay, so now we are moving to the questions. So before that, let me know what are the keywords from text A. Okay, so yeah, definitely we will mark when you read each and every text, we will definitely mark some keywords from each of the options, each of the text. So what are the keywords from text A? Okay, Anjali, give special focus on all the first and last line of each paragraph. Very good, dear. Yes. Okay, so let me know what are your keywords from text A. So I'm just marking, okay. So my keywords, the name of the condition, or PAN, polyarthritis nodosa, which is PAN. Then rare, okay, condition, blood vessel, then the brackets, okay, inflammation, then aneurysms, tissue, rupturing, bleeding, and then enough, okay, oxygen, nutrient, PAN, blood vessels, okay, kidneys, joints, nerves, most people, okay, again PAN, symptoms, again the brackets, again the condition, okay, the provider also. So these are my keywords from text A. Okay, Sindhu, PAN, yes. And what about other keywords? PAN is the abbreviation, right? And also it is in bracket. So yeah, definitely you can mark that. And coming to text B, it's all about the symptoms. So what are the symptoms mentioned here? So all the symptoms you can just mark: fatigue, night sweats, fever, loss of appetite, then pain, headache, skin sores, abdominal pain, blood in your stool, shortness of breath, chest pain, high blood pressure. Okay, commonly, very good. Yes, Sudha, it is commonly is a word that can be connected with time. Okay, then painful testicles, nausea and vomiting, numbness. Okay, and in C, a lot of medical terms mentioned. Okay, so I'm just marking all the medical terms here. Yes, and all the abbreviations, the numbers. Okay, so that's all about C. And text D, okay. Yes, so the last one, text D, again, okay, so the abbreviation, then immunosuppressive, the medication, then numbers, again the brackets, okay, name of the medicines, name of the disease conditions. Yes, so that's all about part D. Text D. Okay, then moving to the questions. So let me know in the comment box, what is your answer for the first question? Okay, yes, Sudha, rarely, commonly. Okay, Sindhu, PAN. Okay, yeah. Then coming to the first question. So what about the first one? Corroboration of idiopathic generalized PAN. Any idea? What is the correct answer here? First one. So corroboration, which means it is connected with experiment, okay, which means confirmation. Okay, so what about the answer? Okay, so be PAN, rare, vasculitis, organ inflammation, weak, stretched, aneurysm, okay, rupture, okay. So first one is from text C. Where is it mentioned in text C? Any idea? So first one is from text C, corroboration, which means confirmation. And that is from text C. So very clear from the last box, see, idiopathic generalized PAN. So that is from text C. Second one, what about the second one? Okay, so B, it is from text C. Very good, dear. Okay, so what about second question? Any idea? Sudha, Sindhu, Reba, Celine, Anjali, Shapna, Libby. Second question. Okay, Libby, first one is from text C. What about second question, dear? Second one. How does this particular condition pan affect the body weight of a person? Okay, so that is from text B, right? Okay, very good. Which is from text B, affecting the body weight of a person, which is from text B. And as you can see here, the first line itself, different parts of your body with a wide range of symptoms. Okay, then what about the third one? Third one, any idea? Third question, distinctions discerned in the dosage of the medicine. So distinctions discerned, then dosage. So distinction, which means the difference. Okay, discerned, which means which are noticed in the dosage of the medicine. So medicines, treatment, management, where is it mentioned? It is mentioned in text D. Okay, Shapna, second question was from text B. Very good, Sobi, it is from text D. So the dosage of the medicine, which is from here, okay, 100 to 10 to 100 times. So dosage is mentioned there. So answer is from text D. So first one C, second one B, third one D. And fourth one, the upshots can be envisaged if the blood vessels undergo inflammation. So upshots, which means the outcome. Okay, and envisage, what can I say? Envisage, which means expectations. Okay, so any idea what is the correct answer there? The outcomes expected in blood vessels which undergo inflammation. Okay, so when you underline the keywords, already we have noted the blood vessel inflammation as well as what? The outcomes. Okay, so a lot of outcomes mentioned, weak and stretched out, then thin to point of rupturing and bleeding. So it's all about text A. So answer is from text A. Very good, Reba, it is from text A, dear. Okay, fifth question. What are the typical prodromes associated with PAN? Okay, typical, which means common, prodromes, which means the symptoms. Okay, so very simple question, symptoms mentioned. Where they have mentioned about the symptoms? All the symptoms mentioned in text B. See, symptoms. Okay, fatigue, then night sweats, fever, loss of appetite, pain, headaches, skin sores, then abdominal pain, blood in your stool, shortness of breath, chest pain, high blood pressure, painful testicles, nausea and vomiting, numbness. Okay, so that's from text B. Okay, then sixth one. Okay, Libby, yes. Fifth question, text B. Okay, dear. Okay, Anjali, fifth one, text B. Yes. What about sixth one? Any idea? Sixth question. The usual immunosuppressants used to treat PAN. So immunosuppressants and treatment. So where they've mentioned about immunosuppressants and the treatment. Okay. So again, it is from this particular text which contains all the treatment options and immunosuppressants. So immunosuppressive or immunosuppressants, which is mentioned in text D. Also the treatment. So answer should be text D. And the last one, seventh one. Okay, so be any idea? Seventh question. Organs usually affected by PAN. Any idea? Seventh question. Organs usually affected by the condition. Where is it mentioned? The organs affected by the condition. Okay. So, yes. So, PAN most commonly affect your kidney, joints, nerves. So, answer is from text A. Okay. So, first one C, second one B, then third one D, fourth one A, fifth one B, sixth one D, seventh one A. Clear? Okay, so coming to 8th one. Frequency of consuming cyclophosphamide. Okay, so yes, name of the medicine. Yes, cyclophosphamide. Yes, any idea where they've mentioned about this medicine? Consuming this medicine. Frequency, which means how many times, okay, in a month or how many times in a day you are using cyclophosphamide. Okay, so frequency of the medicine. Where is it mentioned, frequency of this medicine? Any idea, Anjali? 8th one, any idea? Frequency of this medicine. Okay, so which is from text D, again the treatment options, and frequency should be, okay, so that is frequency should be, usually you only take cyclophosphamide until remission 3 to 6 months. Yes, so answer is 3 to 6 months. Very good, Reba. It is 3 to 6 months. Okay, so that is from text D. Okay, so that 3 to 6 times, which means, yeah, the frequency. Okay, then 9th one. Which organs are rarely presented with symptoms of PAN? Which organs are, so they need which organs? Name of the organs. Any idea which organs are rarely presented with symptoms of PAN? Okay, see, question is asking you regarding organs, not organs. So we need more than one, right? Okay, Libby, one more. Lungs, it is the correct answer, but still one more organ is there. Which one? Any idea? Any idea? Lungs is there, it is one of the organ, but one more is there. Okay, so that is from text A, and it is rarely, see, rarely you may only have symptoms in your skin as well as lungs. So answer is skin, lungs. Okay, answer should be skin and lungs, or you can write skin, lungs. Okay, then 9th one. Name the medicines employed to treat hepatitis B associated with PAN. Okay, name the medicines. So what is the name of the medicine? Yes, very good, Sindhu. Lungs and skin. Okay, or you can write lungs, skin, or skin, lungs. Both are correct. Okay, so what about 10th one? What medicine? Name the medicine. So what medicines? So medications, yeah, treatment, of course, in text D. And which medications? Okay, very good. So medicines which are antiviral medications. So already medications mentioned in the question, so that you can write antiviral. Okay, answer is very good. Yes, Libby, Sindhu. Okay, so be antiviral. Answer should be antiviral from text D. Very good. Then 11th one. The offending of which medication can indicate the presence of drug-induced PAN? Offending of which medicine? So again they need a name of the medicine. Indicate the presence of drug-induced PAN. Okay, so which medicine? Drug-induced PAN. See, very direct answer. Offending medication. What medicine? It is minocycline. Okay, so answer should be minocycline from text C. Okay, any idea? Okay, Jijo, yes dear, it is antiviral. Okay, then what about next one? It is minocycline from text C. Okay, offending. So that is minocycline from text D. Then 12th one. What can be noticed? Sorry, text C. Yeah, so 12th one. What can be noticed in the stool or urine of a patient with PAN? What can be noticed? So which means maybe in I think 12th question from signs and symptoms. Yeah, of course. So any idea what is noticed in stool and urine? See, what is noticed? It is blood in your stool or urine. So answer is blood. Okay, so answer should be blood from text B. That is question number 12. Okay. Yes, so B. So what about 13th one, dear? 13th one. Any idea? Jijo, Sindhu, Libby. 13th one. Which type of blood vessels are commonly affected by PAN? Again, answer to the question. Okay. So which type of blood vessel. So what type or which type? Type of blood vessel. So which type? Any idea? Very good. Yes, it is medium sized. Okay, and where is it mentioned? It is mentioned in text A, and it is an hyphenated word. Okay, so you should write that hyphen there. So answer should be medium hyphen sized. Okay, so medium sized. Very good. And what about the next one? Okay, so Jijo, yes, medium sized. Okay, so B. Okay, Anjali. Okay, Sindhu. Yeah, it is medium sized. Okay, then 14th one. What may appear as hard, tender nodules or ulcers due to pan? Okay, so harder or hard, tender nodules. Any idea? What may appear or what can appear? Yes. Very good. Yes, Libby, it is skin sores. Okay, SORES. Very good. Skin sores. Okay. Okay, Libby, it is skin sores from, where is it mentioned? It is mentioned in text B, one of the symptom. Okay. And yeah, it's here, skin sores that may appear. So that is the key word, which is hard, tender or ulcers. Okay, so that is skin sores. Okay. Then 15th one. Any idea? What is the answer to the question number 15? To prolong remission, the patients may commute to separate dash like methotrexate or azathioprine. Yeah. Okay. So the medication names mentioned in, of course, in text D. So what is the missing word there? Any idea? What is that missing word from text D, including the name of the medicines? Any idea? 15th one. What is the missing word there? So because it is filling the blanks, right? So we just want to find out the missing word or missing words. Okay, so answer is from text D, and the name of the medicines mentioned here, and the missing word is immunosuppressive agents. Okay, so which is from text D. All other terms mentioned, name of the medicine, as well as okay, as well as switch to another. Okay, so switch to another immunosuppressive agents. So answer should be immunosuppressive agents from text D. Okay. Okay, so answer should be immunosuppressive agents from text D. Okay. Yes. So moving to the next one. 16th one. Okay, Jinsi, actually it is not immunosuppressant here, immunosuppressive agents. Okay. Then 16th one. Inflammation can make a blood vessel weak and stretched out, which can lead to dash. It can lead to what? Any idea? 16th one. It can lead to aneurysms. Very good. And where is it mentioned? It is from text A. So that is aneurysms. Okay. Then 17th one. Yeah. So what about 17th one? Any idea? The name of the medicine is mentioned. 𝐂𝐚𝐥𝐴. Then decelerate their dash so they don't cause inflammation. Okay, Anjali. Yes, Jijo. Shapna, Sindhu, okay, Anuja, it is aneurysms, very good. What about 17th one? 17th one. Decelerate their dash so they don't cause inflammation. Okay, so which is mentioned here in text D, and the answer is in this particular para. So can you tell me what is the correct answer there from this paragraph? Very good. Answer is immune systems. Okay. And it is mentioned in this particular paragraph. So answer is immune systems from the last line. Very good. Okay, Asha. It's not inflammation here. It is immune systems. Okay. Okay, Anuja, immune system. Okay, Jijo, immune system. Yes, Anjali, immune systems. Okay, it is immune systems. Okay, not system. Immune systems. Plural. Okay, very good, Shapna. Okay, then the next one. 18th one. So dash or loss of strength in your feet. Okay, and they're asking you regarding the symptoms, one of the symptoms of PAN. So what is it? Dash or loss of strength. So what or loss of strength? 18th one. Okay, loss of strength or dash. So that is from the last symptom, numbness or loss of strength in your feet. So answer should be numbness. Okay, answer should be numbness from text B. Then 19th one, your provider will need to keep checking on you to make sure you don't develop dash in other parts of your body. So what is it? Your provider. So already we have marked the term provider when we underline the keywords from the text. Okay, so any idea? 19th one. What is the missing word there? Okay, Jijo, very good. It is numbness, dear. Very good. Okay, what about 19th one? 19th one. So your provider, see the last paragraph. Your provider will need to keep checking on you to make sure you don't develop symptoms in other parts of your body. So answer is symptoms. Very good. Okay, Sinu, James, it is symptoms. Okay, Shapna. Okay, Anjali, Jijo, yes, it is symptoms. Okay, then we are moving to the last and final question. Okay, 20. The absence of familial or childhood cases and no trace of early onset of stroke with systemic inflammation can indicate the presence of dash. Can indicate the presence of what? Yes. Okay, Janita, yes, Sobi, Anuja, it is symptoms. Okay, so what about 20? Question number 20? What about question number 20? Absence of familial or childhood cases and it can lead to systemic inflammation that can indicate the presence of dash. Presence of what? Okay, so which is from text C, and that should be presence of idiopathic generalized PAN. Okay, childhood or familial cases, if it is absent, if it is no, then it can lead to idiopathic generalized PAN. Okay, and that should be the correct answer. So any doubts in any of the question? Anyone with 20 out of 20? Okay, yes, Shabna, Anjali, Jijo, Anuja, Sobi, any 20 out of 20? May I know? Or any doubts? How was it? How was the section? Okay. Yes. Okay, Sobi. Yes, Jinsi, Jijo, Anjali, Shapna, Sindhu. Okay. Okay, Sobi. 20. Okay. Anyone else? Okay, Anjali, very good. Okay, Sobi, 18. Okay, it's okay, dear. Yes. Okay, Shapna. Okay. Okay, Riba, 19. Okay, very good. Okay, yes. All right. So that's all about today. So thank you so much. So take care and see you tomorrow.